So the next stretch we're going to go over is the self-skin traction flexion stretch. Bit of a mouthful. And this is a really lovely one, especially we talk about the connective tissue, the tightness that can occur in around that scar site and in around the tissue surrounding the scar. So this one not only works the cording to stretch the cord, but it also works on that fascia or connective tissue. So with this, what you want to do is you want to lie down in the same position. You're going to lift your arm up above your head, elbow straight, and then in the axilla or over your breast tissue, you're going to then pull a traction on the tissue, on the skin. Imagine that you have an elastic band going from your armpit down to the hip joint or hip bone on the same side. And you want to stretch that band down towards your hip. Hold it for 5 seconds and then ease off. Again, just stretch the tissue as if you're stretching out that elastic band, elongating it. Hold it for a count of 5 and then ease off. And again, just stretching down, holding it for a count of 5 and then easing off. And then whenever you've repeated it up to 10 times, you take your arm down. Now, that's the first easy method of a skin traction. We can do another self-skin traction. So if that one there isn't just quite getting the stretch on the cord and on the fascia as much as you would like it to, that you're not feeling that tissue stretch, what we can do this time is do the same movement, only we can go in a diagonal. So once again, we take our arm, keeping our elbow straight, and we take our arm up through flexion into elevation over the top. And then this time we've got to imagine our elastic band is coming from our armpit to the opposite hip joint. So our hand goes onto our bare skin, and this time our elastic band is stretching over to the opposite hip. Holding it for a count of 5 and then you ease off. Hold again. Traction first, hold for a count of 5 and then ease off. And again, with the other stretches, you're working up to 10 repetitions at a time. Both these self-skin traction stretches are really lovely because not only does it stretch the cord, because you're getting that full range of movement and you're stretching right from the armpit up and over that elbow joint, keeping the elbow straight. But with the traction, whether it's straight down to this hip or across to this one, you're adding that extra stretch, and it just helps to release all those tight tissues following the cording, but also following the surgery and the adherence of the tissues. So this exercise is another one for self-skin traction, and it is the arrow. So if you imagine you pull a bow and an arrow for a bow and arrow. So with this one, lying down in the same position, your operated side is out, and then your good hand is resting on your chest wall, and you are stretching that over to the good side. So you're applying more of a traction, but your affected side is on a stretch. So traction, self-traction out for a hold of 5 and then ease it off. Again, tension on for a count of 5 and then off. To be honest, sometimes it takes, depending on where your cord is, you want to achieve that stretch. You don't want it to be a sharp pain, but you want to feel that stretch. So it may be that This movement doesn't quite give the stretch, but this one is too difficult to achieve. So you may find going out at almost an angle, but then doing a traction either across the chest wall or down on a diagonal will give you that pull, that stretch that will allow you to feel that the tissues are stretching out. Just remember that you hold it for a count of 5 and then you release.